Yes.
Hi,
Hello.
my name's Jenny. I'm going to be one of the nurse practitioning students that's taking care of you today. So I'm going to be your provider. I'm first going to just do some hand sanitizer, hand hygiene. If you can tell me your name and date of birth.
My name is Dana Hamamar Ha'o, and I'm born 07/17/1996.
Very good, thank you. So we're going to be doing a comprehensive exam for you today, which essentially just means head to toe, looking a little bit more in depth. So there may be some things that we do that you haven't had done before. So first, I just want to let you know if at any time something's uncomfortable or painful at all, you can just let me know and we can find another way to test for what we're looking for.
Okay.
So first things first, I am just going to take a look at your hair, your scalp, your skin, essentially moving from head down. Then we'll look at your neck and everything. I'm going to just put on my gloves here before I go ahead and touch your scalp. Okay, so not seeing any dandruff or anything. Do you have any areas of concern? Any dried skin? Any discomfort?
Not discomfort, but definitely dry over here and behind my ears.
Behind your ears?
Yeah.
Okay. Any tenderness as I'm feeling around?
No.
No? Okay. Okay. Cranial nerves. So a couple of things that I'm going to have you do. It's going to sound kind of silly, but I'm going to have you raise your eyebrows. Okay. And then if you can bite down, clench your teeth, smile. Okay. If you can blow your cheeks out like you're blowing a bubble. Very good. Okay. And then I'm going to ask you about sensation questions. So I'm going to have you close your eyes, and then I'm going to have two different things. You'll feel something sharp and something soft, and you'll tell me what item you think it is. Okay.
Okay.
What is this?
Soft.
Okay. What about this?
Sharp.
Okay. What about this?
Soft.
Okay. What about this?
Sharp.
Okay. Okay, so I'm now just going to be looking at your hands, your nails, and then your capillary refill. It fills really quickly, less than 2 seconds. That's really good. Great circulation. Now I am just going to be palpating. So I'm going to touch a couple of areas on your face and your sinuses. We're just going to take a look at your frontal here. Any tenderness when I'm touching? Okay, now we're going to do your maxillary. Any tenderness?
No.
Your mental and submandibular. Any tenderness?
No.
Okay. You do your preauricle around your ears. No tenderness?
No.
Okay, now around your ears here. Feels okay?
Mhm.
All right, I'm gonna check your jaw here. So I'm gonna have you bite down. Okay, and then can you put your jaw like out? Move from side to side. Any tenderness or clicking there? Okay. So now I'm going to be percussing your sinuses. So it's almost like what I was doing earlier when I was palpating. It's just going to be, I'm going to be tapping on it instead, okay? So it might be a little bit more forceful. So if you feel uncomfortable at all, you can just let me know. Does this feel the same on both sides?
Yes.
Any pain?
No.
I'm going to do 3 different tests. Just looking at your ocular motor. We're looking at cranial nerves 3, 4, and 6. So the first one that I'm going to do is the corneal light reflex test. I'm just going to have you basically stare to the wall, and I'm going to bring the light over it, okay? So I'm just looking at your eye. Very good. Keep looking at the same spot. Very good. Her eyes are equally reactive and they're consensually constricting and dilating based off of what I'm doing with the lights, which is good. That's all very good. Your eyes are appropriately adjusting. Yes. So now I'm gonna have you look at the wall again. Fixate on a point. I'm gonna cover an eye, and then just gonna see what your eye does. There's no movement when I uncover. This is the cover uncover test. So same thing. Okay. Yeah. There's no extraocular movements. That's good. No nystagmus. Now we're going to do the diagnostic H test. I'm going to have you keep your head as still as possible, and then I'm going to have you follow my finger. Okay. We're going to basically make an H pattern here. Very good. Okay. Very good. Okay. Okay, so the next thing for our eyes, I'm actually going to do more of an intense look at them. So first I'm just going to look at your conjunctiva here. So I'm going to pull your eyelid down just a little bit. They're nice and pink. There's no drainage. Is that tender at all? No? Okay, very good. So I am now going to do just an eye exam looking at basically the internal parts of your eye. So the cups, the disc, the retina, the optic nerve, everything like that. So I'll have you kind of keep your eye up against the wall, find a spot, pick it, and stay with it, okay? So just looking at your cranial nerve here, you do have that nice red reflex intact. Okay. Good. Now I'm just gonna look at your other eye here. Red reflex intact there. And everything looks good there in terms of your disc. And now I'm going to move on to your ear assessment, which I'm just going to first inspect it, take a look at it, see kind of what's going on. Any tenderness or discomfort, any changes to hearing recently?
No.
No? Okay, I'm going to gently palpate your ears. So just let me know if anything's uncomfortable while I'm touching. Any discomfort?
No.
Okay, so there's no masses, no swelling, no drainage. Her ears look within normal. So now I'm going to do kind of an interesting hearing test. I'm going to cover one of your ears, and basically I'm going to whisper something in your other ear, and you're going to tell me, they're going to be a sequence of numbers, and you're going to tell me what numbers you hear. Okay? So I'm just going to here.
2, 3, 4.
Okay. Now the other side.
7, 6, 5.
Okay, very good. So now I'm actually going to be inspecting inside your ear. And I know you were mentioning that you have some psoriasis on your ear, so sometimes it's a little bit uncomfortable and you have some dried skin around there. So just let me know at any time it just becomes uncomfortable, okay?
Okay.
So first, I'm just going to be looking into your ear canal to look in your tympanic membrane to make sure that looks good, that there's no evidence of any infection. So I do see some cerumen here, but your tympanic membrane looks nice and pearly white, which is good. And I'm going to take a look at your other side here. Yep, your tympanic membrane looks good. Just going to be inspecting your nose, kind of looking at the turbinates in it, and your bones there, your mucosa, and your septum. So I'm going to have you tilt your head back just ever so gently. I'm going to be taking a look with the light here. Your mucosa is nice and pink. Okay, very good. Okay, so now I'm going to be moving on to kind of your mouth and your lips area. Any dentition problems?
Nope.
So your lips are nice and moist and pink, which is good. Your mucosa is good. I'm going to have you open up your mouth, open wide. Okay. Dentition intact. No discomfort with any of your teeth. I'm going to have you lift your tongue up. Frenulum's intact. Dentition is good on the bottom side there. Okay, so now I'm just going to be assessing your oropharynx, which essentially I'm going to have you open wide. And I am taking a look at your palate, your tonsils, everything looks good, your uvulas, midline. Say ah. Okay, I'm gonna test gag reflex and okay. Just looking at your cranial nerve for your hypoglossal. So now I'm just going to move on and work on your neck. Take a look at that, which there's no signs of any JVD, so no jugular vein distension, which is good. I am going to, if you're okay with it, palpate your neck here. Any tenderness?
No.
So there's no masses. And I'm also, while I'm here, just going to feel your lymph nodes here. Any tenderness with that?
Mm-mm.
Okay, very good. So the jugular vein distension. I am going to listen to your neck for what's called bruise. So just blood flow, that's, just going to listen to your blood flow here. Okay, I don't hear anything, which is good. That means there's no adventitious. Now, I'm just going to be looking at your trachea here, which your trachea is midline, and you said no tenderness. I am going to be examining your thyroid, which I'm going to be behind you. I'm basically just going to be feeling your neck from behind. I'm going to have you take a deep swallow so I can feel that. I'm just looking for symmetry, making sure your thyroid's kind of in the middle where it's supposed to be, that there's no nodules or anything like that. Is there any tenderness when I'm palpating here?
No.
Okay. I'm going to have you take a deep swallow. Okay, no discomfort with that. So her thyroid is midline. There is no nodules that can be felt. I'm going to do something called tactile thyroidus. It basically is just going to look for vibration and conduction on your back, okay? So the phrase I'm going to have you say, repeat, is 99.
Okay.
And I'm just going to be feeling here.
99, 99, 99, 99, 99, 99.
Okay, good. We're gonna be looking at just your chest to make sure it's symmetrically expanding. So I'm gonna be putting my hands here on your kind of where your 10th ribs are. I'm gonna have you take a deep breath in. Okay, so we have symmetrical expansion here. I am going to do two things. First, I am going to just continue percussing the back here. Making sure that there's resonance, there's no areas of dullness. Okay. And then next, I just want you to tell me if you have any tenderness where I'm hitting, okay? So I'm looking at your kidneys here. Any discomfort?
Nope.
Nope. Okay. First, I'm just going to note that her AP diameter is 2:1, and so I am now going to be doing some percussion on your lung fields, which essentially just means I'm going to be tapping a lot in some interesting areas. So I'm just listening for changes in the resonance. Okay. Any discomfort when I do this?
Nope.
I'm just going to do it on your other side as well. I know this part can be a little uncomfortable, so I'm sorry if, just let me know if this is too much for you, okay? And now I'm actually going to be auscultating for your lung sounds, okay? So I'm going to have you take nice deep breaths when I move my stethoscope, okay? And generally it would be under her shirt, skin to stethoscope. Okay. I'm also going to be listening to your back. So if you want to sit up real quick, because sometimes we hear lungs a lot better actually from the back here. So just have a nice deep breath. One more. Okay, so your lungs were clear bilaterally to auscultation when I was listening. So there's no wheezes, no rhonchi, no crackles. So no evidence of any pneumonias or anything scary. In a real life scenario, I would have my patient be undressed for this part, at least down to like a sports bra. So I'd be inspecting their chest. So we're going to say her color is within normal range. It's pink, warm, and dry. And then I am going to be assessing your cardiac section now. So I'll have you lay back down. I am gonna do something that's like a little bit uncomfortable. I had to palpate for your apical pulse, and I'm gonna be listening to kind of your point of maximal impulse, which just kind of happens to be right around your boob, right under your nipple line here, mid-clavicular. So first I'm just gonna feel for your apical pulse here. Okay. And then I'm going to auscultate the front part. So you can just breathe normally like you would. You don't have to take any more deep breaths. We're done with the lungs. So I'm really just going to get in and listen to your heart now, okay? Okay, so now I'm just going to be listening for the aortic, pulmonic, okay. I'm going to be listening with the bell, just listening for higher pitches. Same spot as before, so you can just breathe nice and even. So your heart rate is nice and even, no evidence of any murmurs, which is good. Okay, so now we're just gonna move on to your abdomen, which generally, again, she would not have clothes on. So for now, we're saying that she's not having any scarring, any visual abnormalities, no signs of ascites. There's no evidence of any surgical history or scarring, and no obvious hernias. Now I'm just going to be taking a listen to your stomach and your bowel sounds. And so I'm just going to go on all of your quadrants here. And now I'm going to be listening with the other side of the stethoscope for any evidence of bruise. Now I'm going to be listening for your femoral arteries here. It is low, kind of in your hip joint here. So we listen with both the diaphragm and then again with the bell to make sure there's no bruise. Dana's bowel sounds were normal. There's the normal baborrhea, and then in terms of her femoral arteries, was no bruit, which is good. Moving on to percussing your abdomen here. So there's a couple of things that we're listening for. I'm gonna just check on to make sure that there's area of resonance, and I'm also gonna be basically trying to find your liver border and then get an idea of where that is, how big your liver is, and then your spleen as well on the other side.
Okay.
So we'll start off here. And then just let me know anytime if there's any tenderness or discomfort. Okay. So I'm just going to move on to the other side here. And then when I actually palpate, I'm going to be doing it a little bit deeper. So that might be a little bit more uncomfortable because I'm going to begin right up to the liver border. Is that uncomfortable at all?
No.
No? Okay. Okay. So that's just about 12 centimeters mid-clavicular line here. Okay. I'm going to be palpating now, kind of around that area. So this might be a little bit uncomfortable because I am going to do a little bit of a hook here so I can feel. Does that hurt at all?
No.
Yeah. And then I'm just going to palpate kind of the rest of your abdomen here, okay? Any tenderness wherever I'm pushing?
No.
Very good. No masses. And so now I'm going to be percussing for your spleen now, almost the same thing that I did with your liver. So we're just going to be listening for the resonance here. Which there's appropriate tympany, which kind of just tells me that her spleen isn't enlarged, which makes sense. Generally, our spleen is, we can't feel spleens in normal people unless they have like mono or something that would enlarge their spleen onto your musculoskeletal system. So I'll actually have you stand up, and what we'll do, I'll have you come here. And this would traditionally be done again without any clothes on, but I'm going to have you face that wall right there where the hook is and just bend almost like you're touching your toes to a 90 degree. I would just be inspecting, looking to see if there's any signs of scoliosis, any curvature of her spine. Same time I would be palpating, which there is no evidence of scoliosis here. Moving on with musculoskeletal, basically I'm just going to be having you move your arms in different ways. So the first one, I'm just going to have you bring your arms up over your head, do some nice stretching. We're going to do some yoga here. Okay, and then you put your arms away, and then I'm going to have you move your arm backwards. Okay, is that uncomfortable at all? No. Moving your arms forward, cup position, very good. And then I'm going to have you put one arm across your body. Okay, very good. Now we're going to check the other side there. Very good. So Dana demonstrated that she has full range of motion in her shoulders, extension, flexion, and then abduction and adduction. So we are going to do internal rotation now. So I'm going to have you almost as if you're honestly like taking your bra off and putting it on with both arms. So just seeing, yeah, very good. Okay, perfect. Okay, so we're gonna take our elbows. You're gonna bend, and then we're just checking flexion, extension, and then do the same thing here. So we can test pronation and supination, okay? And we can flip our hands over. So now we're just gonna test your grip strength. And then kind of just your force. So I'm going to push against your forearms here, and you're going to try not to let me push it down, okay? Okay, very good. Now I'm going to pull. Okay, very good. You can grip my two fingers here on both sides. So both of her grips are equal in strength. Have you lay back down, and we are going to be testing your hip rotations and just kind of your muscles and movement there. So I'm actually going to bring this leg up, And I'm just gonna rotate a little bit. Is that uncomfortable at all? What about if I go on this side?
Nope.
Okay. And then we're gonna test this side here. Very good. Sorry for making you do some yoga.
It's
Not
okay.
sure if I mentioned we were gonna be doing this. Okay,
stretch.
we're gonna test your internal and external rotation for your hip here. So I'm gonna actually pull your ankle out this way. Is that uncomfortable?
Nope.
And then internal. Okay. Same thing on this side. Okay. Very good. Now we're just going to be doing some neurological tests. So a couple of kind of interesting feeling things. I'm going to have you touch your nose and then touch my finger.
Okay.
And then keep doing it. Back and forth. Okay, back and forth. Now with your other hand, you're going to do the same exact thing. Touch your nose to my finger. Touch your nose to my finger. Touch your nose to my finger. Very good. Okay. And then now we are going to, I'm going to have you close your eyes. I'm going to put some objects in your hand and you're going to tell me what you think the object is. Okay? They're kind of like everyday items that you might feel and might recognize.
A pen.
Okay, very good. Now this one might be a little different. I'm going to have you hold and feel this. What do you think this is?
TV remote.
Very good. Okay. So now I am going to be writing a number on the inside of your hand. And you're going to tell me what that number is, okay? I'll have you close your eyes again.
$21.
Very good. So now I'm going to be testing your vibratory sensation, basically on your hand. So I'm going to be sharpening the tuning fork and then resting it on your phalange. So on your fingertips. Yeah, just like that. Do you feel that? Yeah. What about on this side?
Yes. Yes.
Very good. So now I'm going to be testing for your proprioception. Basically, I'm going to have you close your eyes and I'm going to be moving your toes, whether up or down, and you'll just tell me what direction you think I'm having your toe be in, okay?
Up. Down.
Okay.
Up. Down.
Okay. Let me stand up. We're going to be testing your balance center here, and your kind of your vestibulocochlear nerve here. So I'm going to have you stand straight, close your eyes. This is called the Romberg test. We're just checking for any swing, any movements. Okay, now I'm going to have you stick your hands in front of you, straight up in front, and then turn your hands up, facing palms up, and keep it there. All right, no swing, no movement, so her balance center is intact. Very good, thank you. So our next test, we're going to do like a tandem walk. So heel to the front of your foot, starting from this wall over to that direction here.
Okay.
So heel toe, very good. Very good. Which I will actually, I'm just going to have you walk on your heels back. Okay. And now we're going to go back the other direction on tippy toes. Walking on tippy toes. Very good. Okay, so last test, we're just going to have you do a duck walk for 4 steps. So basically you're just going to get down and kind of walk. Perfect. Okay, you're doing great. I'm going to be testing your dependent reflexes. So there's a couple of areas that I'm going to hit with the Taylor hammer on your arms and your leg. So first we'll do the patellar knee tendon. So we're just going to test your reflex here. Okay. Okay, very good. So now we'll do the brachioradialis. So you can kind of just relax your arm out here. We're just going to go to the other side here. And we're going to do the brachial reflex here. So I'm going to put your hand on your brachial tendon here. I might actually have you, kind of dangle your arm out. This is just kind of an interesting difficult one to do. And then the last one is the tricep one. So I'm going to have you almost lean your arm like you're on a railing here. Just completely drop your hand, relax your hand. Okay. So now we're going to do that tricep tendon here. Same thing with this arm, lean on it, and then keep your hand loose. And then on your tricep, very good. That is the end of our assessment. Dana, thank you so much for participating. I know we did some yoga, some exercises, and we really got up close and personal. But your assessment was very benign. So what that basically means is everything was within normal range. There was no evidence of any masses, any lesions, any concerning problems with your neurological system, your musculoskeletal, your abdominal system, everything like that, your integumentary skin, and then your ears, nose, and throat were all good. So thank you so much for letting me do that.
Thank you.